Hello there, neighbors. Just a quick mention before we jump into the episode. I've been posting a lot more short-form content on TikTok and Instagram. So if you would be so kind, stop on over to either of those platforms and check it out. It's in the same vein as the things that I talk about on the podcast. Once in a while, there's some content there that's a little bit more lighthearted and comedic than the podcast itself, but I think you'll enjoy it. And if you do, please like, follow, and comment if you would. Alrighty then, let's move on to the episode. Let me mention some words to you. Fraud, waste, abuse, dependency, able-bodied adults, entitlements. Now you hear those words enough times and they stop sounding like words and start sounding like a little budget season spell. You say them in a hearing, put them in a press release, repeat them on cable news, staple them in a chart, and suddenly we're not talking about people anymore. We're talking about categories. We're talking about costs. We're talking about program integrity, which, sounds very responsible, very serious, very adult in the room. Like someone put on a green eye shade, sharpened a pencil, and marched bravely into battle against a spreadsheet. But notice who disappears when that language takes over. The grandmother in a nursing home whose care is paid for through Medicaid. A child who sees a doctor because Medicaid exists. A parent at the grocery store doing mental math in the cereal aisle because SNAP does not make life luxurious, it makes dinner possible. The disabled adult who already had to prove, document, verify, wait, appeal, and explain why they needed help in the first place, despite what Stephen Miller seems to think. The family waiting for housing assistance while rent climbs and wages tap the brakes. The senior who hears politicians talk about Social Security fraud and quietly wonders if the check they depend on is about to become another bargaining chip. Those are real people. But in rhetoric, they get replaced by a character. The scammer, the freeloader, the lazy person, the shadowy villain supposedly draining the country dry with one hand while filling out government forms with the other, which, honestly, would require a level of bureaucratic stamina most of us do not possess. And let's be clear, fraud exists, waste exists, abuse exists. Any large system needs oversight. Nobody serious is arguing otherwise. The question is what happens when fraud becomes the only story we tell. Because once people are convinced that public assistance is mostly a crime scene, it becomes much easier to treat everyone who needs help like a suspect. So, this episode is not really a story about budgets. It's a story about language. It's a story about how hunger gets renamed dependency, how healthcare gets called an entitlement, how hardship gets treated like evidence, and how human beings become line items on a spreadsheet. This is the Cruelty Budget. Happy Wednesday, everybody, and welcome to Your Neighbor on the Left, the podcast where we talk about progressive politics, human decency, and life on the blue side of America's ideological divide. My name is Don Spielis. I am your host. And today we are talking about something we're calling the Cruelty Budget. And this is more about the way things are communicated than it is about anything else. But as always, it's not just words, it's not just ideas. There are people behind these things. So if you've spent any time paying attention to American politics, you've probably noticed something. Whenever politicians want to talk about anything related to public assistance, they rarely start off by talking about the people who depend on it. They start with talking about the people who abuse it. The conversation almost always begins with the story about a scammer, a cheat, a fraudster, someone who's getting benefits they supposedly do not deserve, someone taking advantage of taxpayers, someone gaming the system. And once that story gets introduced, it becomes the lens through which millions of completely different people are viewed. The most famous example is probably the welfare queen. The term exploded into American politics in the 70s and 80s. It painted a picture of a person living comfortably off of public assistance, manipulating the system, collecting benefits she wasn't entitled to, and laughing all the way to the bank. Now, here's the thing. Cases of fraud exist. They did back then, they still do. Every government program has some level of fraud because every system involving human beings has some level of fraud. But the welfare queen wasn't powerful because she represented the average recipient. It was powerful because she represented the exception. And exceptions make great political stories. Nobody gets angry watching a grandmother receiving nursing home care. Nobody gets outraged, when they see a child go to a doctor appointment. Nobody launches a political movement because, a family got groceries. But tell people somebody's cheating the system, now you've got a villain. And politics loves villains. The welfare queen eventually became part of a larger cast of characters. The guy who refuses work, the immigrant supposedly collecting benefits by the truckload, the person driving a fancy car while receiving assistance, the dead person somehow cashing Social Security checks from beyond the grave. The decades differ, the headlines are different, but the same basic story. The details change, but the structure, it's remarkably consistent. And you find the most outrageous example, you put it under a spotlight, and you repeat it often enough that people begin to think it's typical. Then use that perception to justify changes that affect everyone else. Because here's something politicians understand better than most people realize. Human beings are terrible at judging scale. Tell somebody a program serves millions of people successfully and their eyes sort of glaze over. But if you tell them one outrageous fraud case, they remember that for years. The human brain is wired for stories, not spreadsheets. That's why you can show someone all the data you want demonstrating that the overwhelming majority of benefit recipients qualify for the assistance they receive. And 5 minutes later, they're going to whip out, yeah, but what about all those people gaming the system? Because the story wins, the villain wins, the exception to the rule wins. And before long, the exception becomes the public face of the entire program. I mean, try and imagine if we did that with other things. Imagine if every conversation about business started with corporate fraud. If every conversation about churches started with televangelist scandals. If every conversation about police officers started with the worst cop in the country. If every conversation about doctors started with the physician who lost his license for some, malpractice, people would immediately recognize that as unfair. Because most people understand that the worst example of anything is rarely the most representative example of that thing. Yet when public assistance programs are brought up, the worst example often becomes the only example that you're really given. And that matters. Because once people begin picturing scammers, every time they hear the word Medicaid or SNAP or disability or public support becomes easier to erode. The conversation starts to shift. We no longer ask whether there are people who need help. We start asking whether these people deserve our suspicion. We no longer see neighbors, we see suspects. And that distinction is incredibly important because the scammer everyone knows isn't actually the person most likely to be affected by these programs. Not even close. So if the villain isn't the typical recipient, then who is? And that's where the conversation gets interesting. Here's the strange thing about public assistance in America. Most of us know someone who benefits from these programs. We just don't think of them when the programs are being discussed. And that's because political rhetoric tends to introduce us to the exception. Real life introduces us to the rule. So let's start with Medicaid. When people hear the word Medicaid, many immediately picture welfare. They picture someone receiving government assistance because they're, unemployed, living in poverty, whatever. But Medicaid is actually much bigger than that. It covers children. It covers people with disabilities. It covers hard-working families whose employers either don't provide health insurance or provide plans that are just financially not feasible. And perhaps most importantly, it pays for a huge portion of long-term nursing care in the United States. Now, ponder that for a second. When politicians talk about cutting Medicaid in the name of, efficiency or reform, many Americans imagine someone they have never met. What they should often be imagining is someone's grandmother or someone's grandfather or someone who spent 40 years working, paying taxes, raising a family, and just eventually reached a stage of life where long-term care became a necessity. That's not a fringe case. That's a major part of what Medicaid does. And children, lots of children. Kids don't show up in budget debates very often. There are no lobbyists for them. They don't have press conferences. They don't appear on cable news panels to defend themselves. They just show up at doctor's appointments. Or they don't, depending on whether they have coverage. And then there's the working families. One of the most persistent myths in American politics is that people receiving assistance simply do not work. Many recipients do. A lot of them full-time, sometimes multiple jobs. The problem isn't always employment. The problem is often that wages and expenses refuse to occupy, the same reality. And let's talk about SNAP. The stereotype is familiar. Someone who supposedly is living comfortably on government food assistance. The reality is usually a lot different. A layoff, a medical issue, reduced hours, some unexpected expense, a family trying to bridge the gap between stability and crisis. SNAP does not generally transform lives. It prevents a bad situation from becoming a worse situation. It prevents refrigerators from being empty. It prevents children from arriving at school hungry. It prevents temporary hardship from becoming permanent damage. And despite the popular image, many SNAP households include people who are already working. The stereotype says dependency, but the reality, it looks a lot more like survival. Then we come to disability benefits. And if you've never gone through the disability qualification process, you probably imagine it works like critics sometimes describe it. You fill out a form, you tell a sad story, and then you start getting checks. The actual process is often bureaucratic and much like an obstacle course. Medical documentation, reviews, waiting periods, appeals, more documentation, more waiting. People are frequently denied and forced to appeal. Others spend months or years navigating a system specifically designed to verify eligibility. Now, does disability fraud exist? Of course it does. Just as tax fraud exists and insurance fraud and corporate fraud, fraud exists everywhere that money exists. Because, despite all our better angels, humans suck a lot of the times. But the public image of disability recipients often bears a very little resemblance to what the actual experience of providing or proving your eligibility is. The stereotype suggests that it's convenient. The reality often is more like an endurance test. Housing assistance tells a similar story. When critics discuss housing programs, they frequently describe dependency. What they rarely describe are people receiving assistance, seniors living on fixed incomes, people who have disabilities, families whose housing costs consume a staggering percentage of their income. parents who are trying to keep their children in stable schools, or, trying to avoid homelessness. And again, these are not exotic categories. These are our neighbors, people you pass in the grocery store, or, people sitting next to you at a Little League game, people waiting in line at the pharmacy. And then there's Social Security. No program may be discussed more often while simultaneously being more misunderstood than Social Security. When politicians start talking about concerns about fraud and dead recipients and improper payments or abuse, those issues deserve investigation. Certainly, public money should be protected, but something interesting happens when fraud becomes the primary story. The public begins to associate Social Security with abuse rather than retirement security. The conversation shifts away from the millions of seniors who rely on those checks every month, not as a luxury, as a necessity. For many retirees, Social Security isn't supplemental income. It's just the income. It's their mortgage payment and their utility bills and their groceries and their prescription copays. The difference between stability and anxiety. And yet, those people rarely become the face of the debate. They're rarely brought up at all. That's the common thread running through all of these programs. The people most affected by them are not usually the people featured in the political messaging that surrounds them. The spotlight lands on the exception, and the camera ignores or can't see the gigantic crowd behind it. And once you start to begin noticing that pattern, then another question, I think, naturally follows. If fraud is consistently presented as the defining feature of these programs, how much fraud are we actually talking about? Because the answer to that question turns out to be a good deal more complicated than most political slogans would lead you to believe. And of course, this is the part of the conversation where everybody starts throwing around numbers. And to be fair, the numbers matter. If we're going to talk about fraud, waste, abuse, and taxpayer dollars, then facts should probably get a seat at the table. But before we go any further, I want to clear up one of the most misunderstood terms in modern political debate. And that is the term improper payments. You've probably heard politicians cite eye-popping figures about improper payments. Hundreds of billions of dollars, massive losses, government incompetence, run amok. And those numbers are real. But what's often missing is what the term actually means. An improper payment is not automatically fraud. And, say that again. An improper payment is not automatically fraud, no matter how it's presented. An improper payment can be a paperwork mistake. It can be a piece of missing documentation. It can be a processing error, a timing issue. It can be a case where a person qualified for benefits, but a form was completed incorrectly. It can even be an underpayment where the government paid someone less than what they were supposed to receive. I mean, think about that for a second. Imagine your bank accidentally deposits $20 into the wrong account. That's an error. Now imagine someone hacks the bank's system and steals $20 million. That's fraud. Both involve money ending up where it shouldn't be, but they are not remotely the same thing. Unfortunately, political rhetoric often treats them like they are identical. A large improper payment number gets announced, and the audience hears, "Oh, fraud." And the politician never asks to say a word. Your brain fills in the blank. That's where the politics begins, because large government programs process enormous numbers of transactions. Millions of people who filled out millions of forms. It translates into millions of payments and millions of eligibility determinations. No system operating at that scale will ever have a 0% error rate. None. Not a government, not a bank, not an insurance company, not a corporation, no one. The real question is whether mistakes are being corrected when they're found, and whether fraud is being identified and prosecuted. But that discussion is a lot less emotionally satisfying. A headline about billions of dollars supposedly disappearing into some black hole, that gets everyone's attention. And that's because fraud does something politically useful. It creates villains. Every story needs one. The struggling parent trying to feed their children is not a villain. The senior who's trying to afford their medication is not a villain. Neither is the disabled worker who's navigating endless paperwork. But the scammer is perfect. People get angry at scammers. People don't usually get angry at hungry children. So if you're trying to build public support for tightening eligibility requirements or adding more paperwork or reducing benefits or cutting funding, it helps to keep the scammer front and center. The scammer becomes the face of the program. Everyone else just fades into the background. And here's where I think things get especially interesting. Fraud doesn't have to be common to be politically effective. It just has to be memorable. A single outrageous case can generate more attention than 1 million legitimate recipients quietly receiving assistance exactly as intended. And that's simply because human beings remember stories better than statistics. We remember the unusual, the outliers, the outrageous examples. We remember the thing that pissed us off. And the result is that many Americans end up with a completely distorted sense of the scale. We begin to feel like the exception is common and the norm is invisible. And when that distortion takes hold, public opinion is much, much easier to shape. A politician can point to a real case of fraud and use it to justify policies affecting millions of people, none of which who did anything wrong. As a commentator talks, he can spend 10 minutes discussing abuse and never once mention the overwhelming majority of recipients who are actually following the rules. A budget proposal can be framed as a crackdown rather than a cut when you think about it in those terms. The language does a tremendous amount of work in this. That's why discussions about fraud are often much less important than discussions about proportion. How much fraud actually exists? How much money are we talking about? How does that compare to the overwhelming majority of legitimate benefits that are being delivered? Successfully. And perhaps most importantly, what happens when our response to catching a few bad actors ends up making life harder for the millions of innocent people? Because that's the point where fraud stops being a financial discussion and starts becoming a moral discussion. The bigger the villain, the easier it becomes to ignore the innocents that are standing behind them. And when that happens, the next step is usually predictable. The cuts arrive, the restrictions arrive, new requirements arrive. And that's when the rhetoric stops being rhetoric. That's when policy meets reality. It's easy to support a policy when you're only looking at it from 30,000 feet. On paper, everything looks clean. A chart goes down, a budget line gets smaller, a spending category shrinks. Mission accomplished. And, the accountants celebrate. The problem is that nobody actually lives on that spreadsheet. The people live in the real world. And in the real world, policy has a nasty habit of showing up in places politicians never have to visit. A funding reduction doesn't appear as a number. It appears as a long wait for an appointment, or less staff, or delayed approval, lost benefits, phone calls that don't get returned, a form that gets rejected because somebody checked the wrong box on page 17. That's what makes this conversation important. Most modern cuts don't arrive wearing a name tag that says cut. Politicians learned a long time ago that people generally don't like hearing that healthcare, food assistance, or housing support is being reduced. So the language changed. Now the focus is often on eligibility verification or program integrity, work requirements, recertification, administrative reforms. And again, some level of oversight is absolutely reasonable. Taxpayer-funded programs should be accountable. The question is where accountability ends and obstacle courses begin, because every additional requirement creates another opportunity for someone to fall through the cracks. Imagine you're working 2 jobs. You miss a deadline, benefit interrupted. Imagine you're elderly and struggling with technology. A requirement form never gets submitted. Benefits interrupted. Imagine you're disabled and receive a notice written in bureaucratic language that would confuse the average lawyer. Something gets missed. Benefits interrupted. The benefit wasn't technically cut in the most, literal sense of the word. It just disappeared. And for the person affected, the distinction is meaningless. If the result is the same, the paperwork doesn't matter. This is especially true when you talk about rural communities. When healthcare funding shrinks, rural hospitals often feel it first. Many already operate on razor-thin margins. You reduce reimbursements enough and services disappear. Reduce them further and entire facilities start closing. We've seen this since the big beautiful bill came in. Now suddenly a healthcare discussion becomes a transportation discussion. A senior has to drive farther for care. An emergency room is farther away. A specialist is even harder to get an appointment with. A small policy change in Washington now becomes a major life change somewhere far away. Food assistance works very similarly. For somebody with a comfortable income, a reduction in grocery support might sound minor. For a family already stretching every single dollar, it can mean choosing which items stay in the cart and which ones go back on the shelf. Housing assistance, same way. A difference between receiving help and not receiving help isn't always comfort versus comfort. Sometimes it's stability versus instability, or housed versus homeless. Sometimes it's whether a child stays in the same school district or gets uprooted once again. And that's why I keep coming back to the title of this episode, the Cruelty Budget. Not because everyone who supports spending reductions is cruel by default. Most people genuinely believe they're acting responsibly. Most people want programs to be efficient, and most people want fraud identified and stopped. That's all very reasonable. The problem emerges when this efficiency becomes the only value that's being measured. Because human beings aren't line items, no matter how much some people want to make them that. They're not expenses to be minimized. They're citizens and neighbors, they're families. And when the conversation becomes entirely about cost, it's inevitable that something important will get lost. Empathy. Not empathy as a political slogan, empathy as a practical skill. The ability to imagine how a policy affects someone whose life looks different from your own. Because a policy, it doesn't have to eliminate a benefit to make it disappear. Sometimes all it has to do is make that benefit just a little more difficult to reach. And when enough people quietly fall through those cracks, the budget probably looks healthier. But the country doesn't. And that brings me to the final question. If budgets are about choices, then what exactly are we choosing? So yeah, fraud, waste, abuse. Those are the words we started with. And now that we've spent the last, half an hour or so together, I want to ask you a simple question. When you hear those words, what do you picture? Because that's really what I'm talking about here. I'm not talking about the budgets, the accounting, or the spreadsheets, or the government jargon. I'm talking about people. The people that we picture and the people that we don't. The people that political rhetoric puts in the spotlight for us to focus on, and the people it leaves standing in the dark. And at the risk of sounding repetitive, I'm going to say it again. Fraud should be investigated, as should waste and abuse. I don't think that in and of itself is controversial. I don't think most Americans disagree with that at all. If somebody is stealing taxpayer money, stop them. If a program isn't working, fix it. If there are weaknesses in a system, improve it. That doesn't seem like a debate. The debate is what happens when the search for fraud becomes the most important thing, or the only thing, certainly much more important than the people the program is there to serve in the first place. Because eventually, every policy choice reveals what we value. A budget is not just a financial document, it's a moral document as well. It tells us what we are willing to spend money on. It tells us what problems we think are worth solving. And maybe most importantly, it tells us who we are willing to help and who we're willing to leave behind. The danger isn't that Americans, will suddenly stop caring about children or seniors or disabled people or anyone. The danger is that we stop seeing them. That we'll become so focused on finding the handful of people cheating the system that we forget about the millions of people using it exactly as it was intended. That we'll hear the word dependency and never think about the child seeing the doctor. We hear the word entitlement and never think about the retiree who's paying for groceries. We hear program integrity and never think about a disabled person who's trying to navigate a complicated stack of paperwork. And, the term budget savings comes out, and the question is never asked, who is expected to absorb the cost of that savings? Because the cost never disappears, it just moves. Sometimes it moves to a family or a hospital or a senior citizen or a child, but it always moves somewhere. And that's why I keep coming back to a question that feels more important than any of the statistics, any of the campaign slogans. What happens when we become so focused on catching the people who cheat the system that we stop caring about the millions who depend on it? Because sooner or later, every society has to answer that question. And the answer tells us far more about who we are than any budget ever could. All right, everyone. Thank you so much for taking the time to download and listen to this episode from your neighbor on the left. I appreciate it more than I can tell you, and I would love to hear from you about this topic or any other. You can go to the website, neighborontheleft.com, and go to the contacts page and either DM me through social media or use the email address to reach out. While you're there, check out the episodes section, and you can stream or download any episode of the podcast. And when you want to know where I'm getting my information from, go to the blog section, and I do a post for each episode, and I include all of my sources. Be back on Friday with another installment of Back Porch Files. So between now and then, stay engaged, stay kind, and have the kind of week you'd wish for others.